with and without insurance in the US healthcare system. Okay. First, if a patient is without insurance, then obviously it can be challenging due to the lack of financial coverage, right? And what can be the other challenges does he face in this situation without insurance? That's what we are going to see in this slide. Can we move on to the next slide? Yeah. Now, uninsured patients may face difficulties in accessing primary care services due to financial barriers. This limits his regular checkups and any kind of preventive care, and it leads to delayed diagnosis and the treatment. Then also the uninsured individuals often resort to use emergency rooms even for a non-emergency conditions, which is basically because of the lack of access to the primary care, which we have seen in the previous point. This can lead to increase in the costs for both the patient and the healthcare system. Third one is the out of pocket costs. As we all know, patients without insurance are responsible for covering the full cost of medical services out of pocket. And aspect is access to specialty care may be restricted for these uninsured patients, as specialty services are always very expensive. Then uninsured patients also struggle to afford necessary prescription medications. Because of this, some individuals can even skip their doses or even forego their medications. That in turn will worsen their health conditions. Then lack of medical coverage may result in missed opportunities for preventive services. When we say preventive services, it includes the vaccinations or the screenings or and any health conditions. Then uninsured patients often tend to community clinics. Community clinics are always free or even low cost. So the people tend to go to the community clinics to reduce their healthcare costs. Then uninsured patients may need to negotiate directly with the healthcare providers to reduce their fees and to establish payment plans to manage their medical bills better. Finally, the absence of an insurance can lead to significant strain, financial strain, and cause stress and anxiety on the individuals as well as the families. So these are the hardships the patient can go through without an insurance. Now, in the next slide, we'll see a patient is with insurance and now he goes to the hospital, and let's see the possible use cases. The journey typically begins when the patient experiences a health issue or if he needs any preventive care. So in this scenario, the patient initiates the process by entering their medical information into an EMR, which is the medical record system. Following this, the patient can utilize this EMR to even schedule their medical appointments, even with their PCP, their primary care physician. So once the health issue is found, as we all do, we book an appointment and then we visit the primary care. The patient visits their primary care physician to discuss the symptoms or the concerns. Then the PCP may prescribe any medications or recommend any lifestyle changes or even order any diagnostic tests. If required, the patient goes takes his diagnostic test, such as it can be a blood test or it can be imaging, etc. Then he can use the same EMR system that we have seen earlier. Even he can use that to book his lab appointments and proceed. The results of these diagnostic tests will actually help the healthcare provider to make a more accurate diagnosis. In some cases, based on the primary care physician's assessment or the test results, the patient may be referred to a specialist, where the specialist may provide a more focused evaluation or recommend further specialty tests if required. But before in all these cases, but before any procedure or treatment, the insurance company may need to authorize or pre-approve the services. The healthcare provider works with the insurance company to obtain the necessary approvals. Then the healthcare provider then creates a treatment plan, which may include medications or therapies or any surgical interventions. And then the patient usually discusses the proposed treatment plan with the healthcare provider, and they decides on the course of action. The patient is also responsible for co-payments or co-insurance as per their insurance plan. The patient should have some understanding about his insurance coverage and also financial responsibilities before he proceeds with his treatment. Then the patient undergoes the recommended treatment. treatment and follows up with his necessary, healthcare providers as necessary. This may include his regular checkups or any adjustments to the treatment plan. In complex cases, multiple healthcare providers may be involved. This requires coordination of care. In that case, the patient's primary care physician, the PCP, is the central coordinator. He will ensure all the healthcare providers are aware of this patient's treatment plan. After each healthcare services, the provider submits claim to the insurance company for reimbursement, and the patient will receive the EOB, the explanation of benefit statement. This will give details about the services provider, the cost, the amount which are covered by the insurance, etc. In some cases, patient will then continue to follow up with his healthcare provider to monitor recovery. This will come under the post treatment for or follow up, or the patient even focuses on maintaining his good health through preventive measures like checkups or screenings, etc. Okay, so these are the two cases of the patients with and without insurance. So now coming back to US healthcare. Unlike many other developed countries, we may know that US does not have a universal healthcare system. Instead, it relies on a mix of public programs such as Medicare and Medicaid, as well as private health insurance. Now, let's quickly see some of the key features of the US healthcare system. First is the private insurance dominance. Majority of the Americans obtain their health insurance through employer sponsored or privately purchased insurance plan. So this makes the private insurance dominance in the US healthcare system. Then the government programs. We all know the two renowned government programs in US healthcare, right? Which are Medicare and Medicaid. Medicare, federal health insurance program that provides coverage for individuals aged 65 and older, or even to individuals with disabilities or specific medical conditions. While Medicaid, it's a joint federal and state program. This provides health coverage to low-income individuals and their families. Then we have ACA, which is Affordable Care Act. This is also known as Obamacare. This was enacted in 2010. This actually focused to increase the accessibility and affordability of health insurance. This also improve the quality of healthcare and reduce the overall healthcare costs. Then the point is access disparities. This refers to the differences in the ability of an individual or population to obtain and use the healthcare services. This exists because of the challenges such as we have uninsured population, we have limited access to the primary care, etc. Then is the fee for service model. It is a payment system in healthcare where healthcare providers are reimbursed for each service or procedures they perform. Then the various technology integrations like EHR, the electronic health records, and telemedicine. These are actually transforming the US healthcare delivery, and also it's improving its efficiency. You can see a bunch of items in the slide. Then with the healthcare costs, high healthcare costs are a prominent issue in US healthcare, like out-of-pocket expenses, prescription drug prices, and administrative costs. All these contribute towards this higher healthcare costs. Finally, we have the pandemic response. This refers to the coordinated efforts of government and the public health organizations to manage and mitigate the impact of any global outbreak in case of an infectious disease. Example is the recent COVID-19. This pandemic highlighted the strength and weaknesses in the healthcare system. Okay. Now let's move on to the next one. Now it's see the US healthcare subdomains and the systems. The US healthcare is complex, so it involves several subdomains, each playing a crucial role in delivery, management, and the payment of healthcare services. First and the foremost, provider. We all know who are the providers. They include the hospitals, clinics, physicians, or any other entities who deliver healthcare services to the patients. So there are three main systems under provider. First is the EHR, which is the electronic health record system we have seen previously. This is a comprehensive system. This stores and manages patient health information like medical history, diagnosis, medications, or any kind of treatment plans of a patient. The second one is practice management system. This is used for the administrative functions such as scheduling, billing, and claim processing. Then the HIE, the Health Information Exchange System. This facilitates the exchange of information, exchange of health information between the different healthcare organizations to improve the coordination of care. The second one is pharmacy. We all know that pharmacies are responsible for dispensing medications, and also it provides patient education and ensure the safe and effective use of medications. Under pharmacy, we have three main systems: PIS, POS, and NCPDP. The PIS, Pharmacy Information System, this actually manage the prescription dispensing and inventory and patient information within a pharmacy. Whereas point of sale, this is used for processing transactions. This may include prescription sales or any other retail items. The National Council for Prescription and Drug Program (NCPDP). This is standard or widely used for electronic pharmacy transactions. This includes the e-prescribing and claim processing. Third one is the payer. Payers, they are always or often the insurance company. They manage and process claims. They determine the coverage. They negotiate with the contract. They negotiate contracts with the healthcare providers. All these are the roles of payer. Under payer, we have two main systems: health insurance claim processing system. This system actually handle the submission, processing, and the adjudication of healthcare claims, as the name suggests. The second one is payer information management system. This is used for managing the member information, and also their policy details, and it also used for the administrative functions. We have prior authorization system under pharmacy. This is actually used for facilitating the approval process for medications that require pre-authorization, which we have seen under one of the use case before. The next one is the PBM, Pharmacy Benefit Management. In US healthcare, we have this new middleman called PBM, which I'm not going to talk in detail now. We have another speaker who will discuss this in detail. For the final one, which is the regulatory compliance. As the name suggests, this ensures the healthcare entities adheres to laws, standards, and regulations governing to the industry. Unlike Europe, we have only GDPR, but in US we have so many compliance that you can see on the screen that needs to be followed in the healthcare. Under this, we have two main systems: CMS, HRMS. The first one, compliance management system. As the name suggests here too, the system helps organizations to track, manage, compliant, and to be compliant with the various healthcare regulations. Then the healthcare risk management system. This is used for identifying, accessing, and even mitigating the risks which are associated with the regulatory non-compliance. Okay. So this is the quick overview of the US healthcare. Now I'm handing over to SaiHarsha to talk about the next topic.
Thank you, Hannah. So, to SaiHarsha, please uncover the middleman.
Sure. Thank you very much, Hannah, and Muller for the introduction. So first we'll talk about why PBM, right? Before I go to why PBM, let's try to understand where does your healthcare dollar in US go, right? So overall, if you see this data represents commercial health plans spent on premiums, and this is a 2022 data taken from the averages of 2018 to 20. And in this nearly 83 percentage of the US healthcare money, it goes to medication and medical services. Now if I talk about the first five components or the areas where this amount goes to, right, 22.2 cents are used to pay for prescription drugs, and that's where the pharmacy benefit management comes in place, and they generate maximum revenue through this prescription drugs. And 19 cents are used to pay for inpatient hospital costs, and 19.9 cents used to pay for outpatient hospital costs. 11.8 cents are used for doctor visits, and 3.8 cents are used for federal, state, and local taxes. So this is on a overall the top five components or the areas where the US healthcare dollar go. But as you see, prescription drugs is the major area where the amount is spent, and that's where the PBM comes into place. And I'll talk through about PBM now. So Malar, next slide, please. Yeah, pharmacy benefit management. PBM Basically, they refers to the process of managing prescription drug benefits for health insurance plans, employers, and other organizations that provide healthcare coverages. They play a very significant role in the healthcare system by facilitating the administration and management of prescription drug programs. That's where they act as intermediaries between drug makers or the pharmaceutical manufacturers, pharmacies, and insurance companies or employers. The PBM industry is also very dynamic. The way it every year unfolds, right? The way it grows is depending on various factors, because it is influenced through some of the economic conditions, technological advancements, regulatory developments, and public health considerations, right? So now I want to talk through about the drug distribution works. So which PBM is, as I said, prescription drugs is where they generate the maximum revenue, and drug distribution is where the key role of the PBM. They primarily act as an intermediary between drug maker, pharmacy, and health insurer or employer. Right? They also perform different roles like drug benefit administration, formulary management, price negotiation between drug maker, pharmacy, and the employer, pharmacy network management, mail order and specialty pharmacies, manage clinical programs, patient and provider support, reporting, and also compliance. So the red person here, the PBM, right? As you see, they act as intermediary between drug maker, pharmacy, and health insurance. So for with pharmacy, they negotiate with a good reimbursement for drug and dispensing fees, and with drug maker and health insurer or employer, right? They negotiate and get rebates out of it. So the majority of the PBM, they generate revenue through rebate, which is after selling a product, the whatever the revenue they are going to, extra money they are going to make, it will be distributed among the drug maker, health insurer, or employer. And also administration fees is also taken by the PBMs to generate maximum revenue. So and drug maker, as you see, they distribute this products to wholesaler, and wholesaler supplies to pharmacy. They sell the products to consumer, and consumer usually take the products through health insurer or the employer. And that is where we have said that PBMs act as a very key role in the overall prescription drug area, and also in the drug distribution work. So there are different other components which involves in the PBM space, which we will see in the next slide. Yeah. So formulary management, pharmacy network management, payer contract management, claims processing, drug pricing, contracts with PBMs, contract with pharmacy, contract with manufacturers, with payers, mail order pharmacy, clinical programs, rebate reimbursement, drug utilization review, data integration, benefit design and consultation, and implementation. So these are the 12 primary components of PBM, right? Which we will not talk through in detail in this session, but we have a series of sessions planned in 24, which we look forward for from everyone to attend and get more benefit out of PBM learning series. That's all on high level I want to cover about PBM. Over to you, Malar, on the next.
Yeah, thank you, Harsha. And Hannah was talking about integrations, right? So our next topic is integration. Oh, to me too. Please go ahead with your session.
Thanks, Malar. So, hi everybody. Today I want to share something about integration and how it works in healthcare. Uh, Integration is a work which nobody can see, but quietly does everything in the background. Let's see it via an example in emergency ward. Please begin. So somebody kept shouting, saying that Caucasian male, 35, with multiple fracture and bleeding head, BP 70 by 100, and then a stretcher came by, and the person was really, really badly hurt. So the doctor is shouting that she wants a ribs X-ray for her the ribs, CT scan for the abdomen, and she wants them to start IV so the transfusion can be performed, and they are also asking to give some painkiller. Now, as they enter emergency ward, there is a physician who, based on some details and cards that they were able to pull from the pocket, is able to open the EMR they already had. From that EMR, she was able to look into the history and found out that the person has sickle cell anemia. So they have to be dealt very properly. So there are thicker chance that they will definitely have less blood right now because they have also gone into an accident. So quickly the doctor says that shouts that please check for blood count, and the lab person there immediately starts looking into the blood count. And of course, pharmacy is always in the play. Pharmacy starts sending medication because we have to induce the IV immediately, and then rest things can get started. So based on when they say blood is needed, uh, based on the counting, 4 units of blood is required for the patient. So we can see 4 units of blood is being sent. So this is a blood bank and it is ready with 4 units of blood. Then as they said that they need a CT scan and an X-ray, so that is performed. And once that is done, can you move next? So doctor is able to see and they say that there is no trauma. Okay. Next, our doctor comes in, watches X-ray, and says that probably the left arm would require a surgery. Once the surgery is performed, next step is that you have to be watchful about the patient because they are critical and any complications can happen. So they are sent to ICU. Now, in the next slide, we will see how silently integration is working. Now, the patient came in and
I think, Meetu, we lost you. Okay, I will cover for Meetu. So when the patient came in, they were shouting that male 35, multiple fractures and bleeding, right? So at the same time, what happened in the back end? So a request been sent to the insurance as well, but meanwhile they have took the EMI record. So in the EMI record, you can see all the details are being listed out here, starting from the encounter, family history, orders, and what he's allergic to. Everything is written here, and also the insurance request was sent to insurance companies so that we may know whether he have insurance or not. But it will take some time, but doctors will not wait for that, so they will proceed with further actions. Okay, so once the patient comes into ICU, emergency, so other things such as to pharmacy, blood requirement and drug requirement was sent. So Meetu, are you back?
yeah, sorry
Yeah, you
about
can
that.
cover from here.
Yeah, sure. So once the EMR is entered, we saw there was another physician in the emergency. So she would enter the required, like here they are telling that it is inpatient, and when is the encounter done? All those things is entered, and that means a new encounter and a new visit is entered. Based on that, immediately all the departments that we saw in the background, right? The the pharmacy, the radiology, the blood bank, and all the departments. Actually, there are numerous departments that are contacted. I kept it small. All are sent a message ADT A01 telling that a new patient has been admitted. So be prepared for whatever is being asked. Also, they can see from where this certain ADT has come. So if it is emergency department, they understand that how quickly they have to react. Can you move next? Also, when they say that, okay, all this x-rays wanted, CT scan is wanted, and they want blood count. All this comes under our order. So it is said that with all those codes and everything, it is neatly put in here. So once that is done, from here it is pulled, and a HL7 message called ORM 001 is sent to all the departments as required. Like we wanted for medication, so in pharmacy we sent first. Then we also parallelly sent to for MRI. We also sent for this blood count. We also requested for blood, and we also called a surgeon to look into the patient quickly. Once as the blood count was requested and it was immediate, that is done, and upon testing, a result is sent out telling ORU R01, that is the observation. It says that 4 unit of blood is required. Why? Because the blood count is 6, so which is very very low. Everybody understands that. So immediately after that, sorry, can you move next? So immediately those 4 unit blood is required, is an order is sent to the blood bank. So I am closing from here. Hope I was able to share enough information. Thank you, Malla, for the time. Thank you, everybody.
Thank you, Misu. And that's up with US healthcare. If you have any questions about US healthcare, you can ask. Now we are moving towards UK healthcare. Okay, let us start. Over to Titian, your area, UK healthcare. You're on mute, Titian.
I think so. Yep. Hi, Mother. Thank you. Yeah. Since already Hena and others spoke about what is healthcare, patient journey, integration, which is almost similar to UK healthcare. Okay. So I'm just going to talk about some of the key features in the UK healthcare, which is quite, sorry, I'm getting an echo. Is it okay now?
Yeah,
Yeah.
go ahead.
So I'm just going to talk about some of the key features in the UK healthcare. Okay. The main focus of UK healthcare system is free healthcare for all, irrespective of variations. Okay. To accomplish this, they have a publicly funded healthcare system called NHS. The abbreviation is National Health Service. Okay. So each citizen of UK should get registered with NHS. So they will be getting an unique identifier called NHS number. It is similar to Social Security number of US. Okay. Here, doctors are referred as general practitioners. And one more thing is like here, the referral is from a GP is mandatory because the treatment is going to be funded and given by the government registered hospitals, right? So, referral from a GP who is being registered with NHS is mandatory. So, this is one of the key features in the UK healthcare system.
Titian, I think we lost you. Sorry, guys. Something bad is happening at Titian's end. Okay, I'll cover until Titian comes. So here there are two things. One is NHS, right? So every citizen have to get NHS number. Likewise, in US we have SSN, Social Security number, right? So in a similar way in UK healthcare, you need to have a NHS number which is unique, and this NHS number is required to get the insurance, and as well as you, whenever you go to hospital, they'll be asking your NHS number. Yeah, and so, what is NHS? National Health Service. And it is a publicly funded healthcare system in the UK. And it is primarily funded through taxation. And you can see there are four worst categories in NHS. One is NHS England, NHS Wales, NHS Scotland, and NHS Netherlands. And let's move on to the funding part. So you can see here what is being funded and what is not being funded. So that is what been given here. So starting with accident and emergency service, and maternity care, and family planning services included, not including the infertility treatment and abortion. So what is included and what is not included, right? So most infectious diseases and treatment for physical or mental conditions, even that is being covered, and home visits, community based nurses. So in US healthcare, we have HLF, ALF, home infusion, assisted living facilities, right? So in a similar way, UK healthcare also has home visits by community based nurses is being covered here. And rehabilitation, including physiotherapy and stroke patients, are being covered, and palliative care is being covered, and all preventive services is being covered. And moving on to the data management. So how data is being managed in UK healthcare? Because in US healthcare, we know how it is being managed, especially with EHR, EMR is where we used to manage all the data, and that also need to follow certain regulations. But in UK healthcare, we have two systems. One is NHS Digital, another one is Spine. So NHS Digital is where it is where the data is being saved, and including the data and information services, everything is being with NHS Digital. And Spine is like a EHR for US healthcare, so where it serves as the base to share across multiple hospital. So if you go to multiple hospitals, if you want to share the information, then you can access via Spine, right? And apart from that, you may worry about how data security and privacy is being managed in UK healthcare. So we have a super security in NHS Digital and Spine security, where you can seal the information here. You can seal what information need to be shared when you move from one hospital to another hospital. You can restrict, okay, certain information to be shared and certain information not to be shared as well. So everything will be shared only with the patient consent. So you need not worry about the data security and privacy. And we have Titian back. Yeah, Titian,
Yes,
take it
sorry,
from
because
here.
of the network problem. Yeah.
No problem.
So, as Malar was saying, we have spine security, which actually talks about if the patient is going to be marked as spine. Before that, hope you have explained about spine system, right? It is a central repository. Can we move a step back? Sorry. Yeah. When we talk about this data management, here we have the NHS Digital actually is the one which maintains the patient.
Sorry, Titian, you're again lost.
Okay.
Yeah, you're back.
So, yep. So this is the center where, so because of this, now when I say the patient is allocated an NHS number, it means the person is getting registered in the spine and the person is going to be given a NHS number. Okay. This will happen at the time of childbirth itself. If not, whenever the person is getting his first treatment, okay, at that point of time, the NHS number will be allotted. Okay. So now moving on to the next slide. So what are the details that is being captured by the spine is being listed out in the previous slide. So when we come to the security and everything, first is the spine security. This is apart from the data security and everything, these are the security which is actually controlled by the patient's input itself. If the patient says that I want to remain as a sensitive patient, for example, the prime minister or something, whose details cannot be shared to everyone, then that person will be marked as sensitive patient, so that only the number will be displayed, NHS number will be displayed. Apart from that, none other details will be displayed to any other persons apart from his GP. Okay. If at all, if anybody wants to see the details, then the GP should authorize that person to see the details. That is what called as spine security. Then we have legitimate relationship where a certain work group, for example, the maternity is a work group. The doctors, nurse, whomsoever within that group will have that. And only that group can view the data of that treatment. Others cannot view that data. Okay, that's what legitimate relationship. Confidentiality again is similar to that, and patient consent. Since the data can be shared from one hospital to another hospital, If the patient says I'm not consented, I have dissented to share the information across hospitals. For example, a patient may want his mental health not to be revealed to other persons, other hospitals. In that case, he can say that I don't want to share. Then in that case, this variable will be captured so that it will not be shared to other hospitals. And the national data output is something whether my detail can be shared for the research work or not. Sealing is something, if the, for example, if only one allergy needs to be masked, this allergy should not be shown to others. If I'm going to say that, then particular record item alone can be masked. That is, we use of sealing, we can do that. Okay. So these are the, apart from other data security and compliances, we have these items which pay, based on patient's input, we are going to control. Okay. And coming to the next thing, NHS is broadly classified into four trusts. One is acute care trust and mental health trust, ambulatory services, and community trust. Acute care is something like primary care, secondary care, where skilled assistance is required, tertiary care, the treatments where some surgical procedures are required. Okay. So these and all comes under acute care. And mental health trust, as the name suggests, and ambulance services, since the ambulance services are treated as a separate entity, we have a separate trust for that. Okay. When I say trust, okay, what is meant by a trust? It is nothing but group of hospitals is called as a trust. Okay. So can we move on to the next slide? NHS, we have many trust. Okay, it can be trust 1, 2, 3, 4. We have n number of trusts that covers England, Wales, Scotland, and other areas. Okay, and if you take Birmingham Women's Hospital, okay, it is one of the trust. It is the university hospitals where we, under that we have 5 hospitals. Okay, Queen Elizabeth, Heartlands, Solihull Hospital, and mostly. So how the IDs are being given is like, we will, the patient will be given one NHS number, as well as against each hospital he will be given a PAS ID, which is called as the patient administrative service number, which each hospital will be providing for that. Okay, so these are some of the key aspects of UK healthcare, and key terminologies also I can say, which stands out from rest of the other world. Okay, thank you.
Thank you, Titin. Okay,
Thank you.
so that's in was a UK healthcare overview. So we have seen US healthcare overview and UK healthcare overview. If you have any questions, please unmute yourself and ask, or you can post in the chat as well. Right? Okay, let's move on to our next topic, healthcare 2024 trends. So, so what are healthcare 2024 trends? So starting with personalization. Personalization is not only in healthcare, it is everywhere, starting from e-commerce domains to healthcare. It didn't leave one person. So health personalization is everywhere. And that's why, genomic medicines, the genetical personalized medicines is also been a trend now. And coming to applications and whatever the systems that we use during our patient journey, so everything need to be easily searchable and summarizable, and it need to provide a good report. So that is one of the major things that people are looking for. And another trend will be enhanced patient care. So now the personalization goes to another level where they want enhanced patient care, and people want to reduce their wait time, including me. So I used to waste 1 hour of one day whenever I go from one hospital to another hospital, right? So that enhanced patient care need to be there. And especially when you are handing off the patient from one nurse to another nurse within hospital administration, I'm saying, let's think about the inpatient hospital facility, right? So when we are moving from when the patient is moving from one patient one when the one nurse to another nurse, then the how the handoff should be there, how their active records should be maintained. So with the help of AI, even the handoff can be facilitated well. And value based healthcare is been a trend for 1 or 2 years back as well, but now with the help of next gen AI, we can make sure that we can provide a better telemedicine, remote monitoring, and everything. And health chatbots, even last month I had some ailments, the one thing that immediately comes to my mind is one of the health chatbots that I frequently use. So I used to go go there and I used to paste all my I mean my symptoms over there, and it is providing a better suggestion, so after that I can decide whether to visit my physician or not. So that is really helpful personally to me. And moving on to organization side, so we need to revolutionize the operational efficiency, not only in healthcare domain, right? So everywhere we need to every year we are trying to reduce the operational efficiency by optimizing the administrative work, and especially nowadays with gen ai. And even in the drug discovery part, there is ai who was there for ai driven drug discovery and telemedicine and remote monitoring. When we are talking about value based healthcare, it is inevitable, right? And moving on to regulatory activities, so whenever new technology emerges, especially now AI became the very big trend, yeah. And recently you might have seen the Biden's orders as well. So where how many regulatory activities need to be there whenever you are developing a product with AI. And despite of healthcare, whenever we are developing a product including AI, try to build it as a responsible AI, right? So I can send you some links afterwards after this session to go through hacks principles. So it's mandatory for everyone in any domain to go through the hacks principles and build a responsible AI, right? And to remain compliant, we need to follow all the recent regulatory activities that is being released. Yeah. And moving on to the other thing that in 2024, where we can see profit. So this is a McKinsey profit model based out of a lot of service. So in the profit model, you can see from the payer side, we can see there are multiple type of plans over there, right? So especially individual plans and dual plans have the good profit because of the recovery during post pandemic, right? So during pandemic it was not there, but especially post pandemic, so there was a big increase in dual plan population. That is dual plan in the sense the people who are eligible for both Medicaid and as well as Medicare, right? So the population is getting increased a lot. And also there is a great recovery after pandemic. This is a post pandemic season and there is a great recovery too. So here is where we can see the profit. And on the provider side, office based physicians is where we can see profits. And on the services side, especially software and platforms will always be there, right? Because the technology is evolving, trends are changing, so software and platforms will always be there. Apart from software and platforms, what are they? So there is clinical services and consulting and payment services, and data and analytics is inevitable in any domain. And these are some examples, where you can see some profit and where you can see less profit. Let's move on to our next topic, AI in healthcare in 2024 and beyond. So when I say AI in healthcare, it is no more a new trend, right? So it is inevitable. It is always there. So we can say, welcome to new normal. And I would like to hear from any of you about your experience, your personal experience in AI, especially in healthcare. Can any one of you unmute and share some experience with us? What have you experienced in healthcare, especially while using AI? You may use. Can anyone unmute and share your experience? Yeah, go ahead.
Hello everyone. Yeah, I can share my quickly share my experience as medical physicist with AI helping for delineation of organs for treatment planning. It basically shortly it helps painting organs on the EMR and computer tomography pictures. So, but I can talk about it quite extensively, but I don't think it's I should do that. Maybe I should uh, pass the word to someone else, or if you have any questions to to dive deeper, you may ask me as a
What
former
is the
medical
device
physicist.
is being called, Alice? So what is the technology is being called for pasting the colors on the organs?
Oh, actually, colloquially, it is like artificial intelligence, but
Okay.
particularly, I cannot disclose particular technologies,
Okay.
but I can
Okay.
tell you about like companies. It's a Brain Lab.
Okay.
It's a Eclipse, Varian Eclipse,
Mhm.
and it's Electa.
Okay.
Um,
Thank you.
yeah,
Thank
mostly
you
it's
for
about
sharing.
oncology. Thank you.
Okay. Thank you for sharing. And moving on to, so there are so many use cases in AI, but I would take three main use cases. So one is predictive analytics, right? So predictive analytics in so many areas, starting from chronic disease predictions and preventing readmissions by how we are predicting everything very proactively so that we can prevent readmissions by providing some preventive measures and improving patient engagement and personalized treatments. Yeah. And another one is robotic surgery, right? So starting with nanorobotics and robotic colectomy. So nanorobotics is where, delivering medicine in nano areas within the body to repair tendons. And robotic colectomy is where surgeons remove cancerous portions of the colon and rectum, as well as the tumors and polyps as well. And the third one is the Da Vinci system. So Da Vinci system is where we use robotic arms to manipulate surgical instruments, allowing surgeons to perform complex procedures with greater accuracy and control. And the fourth one is cyber knife. So the robotic surgery system that delivers radiation therapy to tumors with sub-millimeter precision. And another trend would be AI medical imaging. So just now Oles was talking about it, and especially so in AI medical imaging, it is with AI we can detect the breast cancer and brain tumors and cardiological problems in a better way. And I want to call out one particular device, which is Page Prostate device. So in pathology, the first marketed AI device is Page Prostate, a software device applied to digital histopathology images of prostate needle biopsies that uses neural network to classify an image as a suspicious or not for the prostate cancer. So these are some examples that I can say, but there are so many more. And here are some tools, very popular tools in healthcare. So one is Impulse Brain Training. It's a cognitive training app, and you can use it on certain patients where you need some brain gym activities. Yeah. And there is DeepScribe. So DeepScribe is a AI powered healthcare documentation tool for organized patient records and also streamlining the task, allowing more time for quality patient care. And Merative, it was formerly IBM Watson Health, and now it is Merative, so which is a cloud-based AI platform for real-time medical data storage and analysis. And there is Twill, which integrates mental and physical health with digital first care. It uses AI, including machine learning, NLP, for personalized care plans. And it also can be used for tracking patient progress, empowering individuals and healthcare professionals. And here are some companies, which I want to call out, who are going to mark a big mark in 2024, especially by using AI in healthcare. So starting with Babylon Health till Microsoft, there are so many things that they are doing. So Babylon is offering a AI-powered virtual clinical appointments, and Komodo is trying to provide a data-driven insights, and Philips is trying to do some R&D in health technology, especially in data science. And Siemens is a global leader in AI patent applications for medical imaging. And NVIDIA aims to harness AI and high performance for computing healthcare advancements. And Intel Corp collaborates with healthcare leaders for drug discovery and pharmaceuticals and healthcare access. And Google DeepMind focuses on AI breakthroughs, including AlphaFold for predicting protein structures. And AWS, so there comes our AWS Health Scribe for speech recognition and generative AI in clinical documentation. And Merative, we already explained what it is. And Microsoft, what Microsoft is doing, they are trying to provide a better healthcare experience with trusted capabilities, offering AI solution to optimize patient time and reduce administrative burdens. So that is what comprises our session. And here is where we are going to show you, so what are our plans for 2024. So we have done our healthcare overview session today. So we are going to see two more session, claim processing session 1 and session 2 in February. So apart from that, we have planned these topics for 2024. But if you participants, if you want to ask something or discuss something, or if you want to provide more topics or different topics, please help us by unmuting yourself, or please use chat as well. So whatever you wish. That's all from us. Any other topics if you want to give, please provide. And here is our planned speakers for 2024. But if you want to be a speaker for any of the topic as well, please provide your name. You can contact me, or you can use this chat, or anything that you wish. We will send us sources after the session in an email. Any questions, anyone? Okay, but please send us if you want to cover any other topics as well. Thank you so much everyone for your time. Let me stop recording.